Good day, everyone. I'm Garrison, moderator for this webinar. On behalf of the organizer conference panel, I welcome everyone for today's webinar, Care Coordination, Coding and Reporting 2022 Medicare Updates. I'd now like to introduce our presenter for today, Tony Holmes. Tony Holmes, CCS, CPC, CPNA, CRC, AHIMA approved ICD-10 CCM PCS trainer, is an internationally known speaker and recognized subject matter expert on medical coding, reimbursement, and revenue cycle management. She is the founder and CEO of Alpha Coding Experts LLC. She holds multiple credentials with the American Health Information Management Association and the American Academy of Professional Coders. And I'd like to hand over the floor to the speaker. Over to you, Tony.
Thank you so much, Gary, and thank you to all of our attendees today, whether you're listening live or on the playback. I'm really excited to talk about our topic today, which is navigating Medicare coding and reporting updates for care coordination and care management services. As far as our agenda today, we're going to be talking about the high-level coding updates specific to care management services, care coordination services. So we'll dive right into, first we'll start with principal care management services, then we'll shift to chronic care management, complex chronic care management, and then we'll get into the remote monitoring services. So principal care management is a subset of chronic care management, and it's basically a service for patients that have a single high-risk disease. So our principal care management codes, we're going to be looking on this slide at 99424 and 99425. So that disease-specific care plan. So the first 30 minutes of a patient's PCM services in a calendar month would be reported with 99424 if it's provided personally by a physician or QHCP. So 99424, 99425 are going to be our physician and NPP-based codes. So in terms of reimbursement, these are going to be Medicare non-facility reimbursement rates. So our physician-based PCM codes 99424, 99425 are obviously going to reimburse a little bit higher than our clinical staff. So now we'll segue into chronic care management services. And the goal was to ultimately reduce hospital admissions, readmissions, and to provide that extra hand-holding and support that patients really need when they have a lot of complex medical conditions. So CCM, we've got 99490, so that's going to be our base code. So 99490 is going to be your first 20 minutes. And then the add-on code for that is 99439. So then we get into our physician-based CCM codes. So we've got 99491 and 99437. So as far as the reimbursement, the physician-based CCM rates are actually a lot higher than the clinical staff-based rates, which is understandable. So with that cost share comes the necessity to collect for the services, and so you want to make sure that that's being done, because if not, that's going to create a lot of other issues and potentially violations. Now we'll talk a little bit about complex chronic care management. So with complex chronic care management, really the big differentiator here is going to be the medical necessity. So these time thresholds are higher than PCM or than the CCM thresholds. And then we have our reimbursements. So reimbursements are really high for these services, as we would expect, because they require a lot more time. So $89.89 for the first 60 minutes, and then $50.36 for each additional 30 minutes of service time. All right, so now we're going to segue into one of my favorite topics, which is remote patient monitoring, so RPM. But remote physiologic monitoring falls under CPT codes 99453, 454, and then 457, 458. Then we have our ongoing device monitoring code, so 99454. It's remote physiologic monitoring is the technical description. You'll hear a lot of folks say remote patient monitoring, but that can be a little bit confusing. So CPT codes 99457, 99458 are for the treatment management services. So these are the service-based components of the remote patient monitoring services. So let's talk about the reimbursement. So then we have remote therapeutic monitoring, also known as RTM. So RTM is brand new as of 2022. It's something that a lot of folks are interested in. It's all the buzz right now. So as far as billable providers, we're looking at physicians, nurse practitioners. So as far as the FDA device requirement, so I mentioned this earlier with remote patient monitoring, but it does require that FDA-approved device. With RTM, very similar to RPM, we have our service component, which is the practice expense component, so the initial setup and patient education on the equipment, so it does require that device, and then our RTM, treatment management services. So as far as our reimbursement, kind of similar to what you saw with RPM. So we've got our setup, $18.82. So the core differences between RPM and RTM. So RPM is going to be on the physiologic data, the biometric data points, things like heart rate, blood sugar, blood pressure, weight. And then your RTM is going to be things like pain levels. Maybe they just had a total hip replacement or total knee replacement. And so the therapy adherence or medication adherence or response, all of those things would be tracked with an RTM device. So medical necessity. So we cannot provide any of these care management services without established medical necessity. Really important compliance considerations specific to care management. So the services obviously need proper documentation. So you'll need logs. And with anything, you want to make sure that you're monitoring. So if you're going to implement a chronic care management program or any of the care management services that we talked about, or care coordination services that we talked about, you have to have ongoing oversight. So some resources that have been referenced in creating this. So thank you so much for your time and attention today. I wish you the absolute best luck in your journey for pursuing care management, care coordination services, and I hope you have a great rest of your day. Thank you so much.
Thank you, ma'am. Thank you, participants. So with this, we conclude the session for today.